We're kind of like at the tipping point for everyone moving towards hormone-sparing sterilization, mainly because the World Small Animal Veterinary Association has come up with a guideline that says that regular conventional spaying and neutering is no longer good, and that it actually causes all sorts of different problems, from inflammatory condition, hormonal issues, allergies, immune system issues, cancer, injuries. The list could go on. Hello, my dog lovers. I am super thrilled about having two amazing guests with me today. My colleagues, Dr. Moira Drosdovech and Dr. Mike Lavroff. They're actually from British Columbia, Canada. And when I discovered that my dear friend Moira has been doing hormone-sparing sterilization for the last 15 years, my first response was, why didn't I know about you, Moira? And I was just so thrilled to actually learn that we have a lot to talk about, and that you'll be able to, and you, Mike, as well, because you've been doing the same thing, that you'll be able to give us a feedback and share your practical experience from all you've done for the last many years. We're kind of like at the tipping point, general tipping point for everyone actually moving towards hormone-sparing sterilization, mainly because the World Small Animal Veterinary Association has come up with a guideline that says that regular conventional spaying and neutering is no longer good, and that it actually causes all sorts of different problems, from inflammatory condition, hormonal issues, allergies, immune system issues, cancer, injuries. The list could go on. So I'm going to pass the talking stick on to you, Dr. Moira, and I would like you to tell our viewers and listeners what you've been doing and who you are and what your background is. And then we'll pass it on to Dr. Mike. Is it okay if I call you Dr. Moira or Dr. Mike? Because it's
absolutely.
We can call each other Peter and Moira and Mike. I'm fine with that.
That's also good.
Okay.
All right. Great. So yes, my name is Dr. Moira Drosdovech, and I've been a vet now since 1987. So we're talking, I guess, 38 years almost as of May. And probably the last 25 have been more holistic. Dr. Mike and I both, and he'll explain this too, we took the homeopathic course, which is actually where I met Peter way back in 1999, 2000. So we've known each other for 2.5 decades, Peter.
I know. And we have common friends as well. I know. We've been the ones who have to fearlessly defend holistic medicine.
That's right. And, taking some arrows in the butt, absolutely. That journey began in 2000, and I sold my conventional practice and opened up Positive Veterinary Care, which we've had running ever since. And we went into all the stuff, of course, about not over-vaccinating and raw foods, herbal medicines, homeopathy, of course, because we took the course. And then along came sometime in the late 2000s, I believe it must have been somewhere around 2009. I honestly can't remember exactly what occurred to get us on the path of the hormone-sparing sterilizations, but I lost my own Bernese mountain dog. This is my personal story. She was born in 2000 and she had a litter. And at 3.5 years old, I spayed her the regular way, which is ovaries out, uterus stays in. About 1.5 years later, she started developing symptoms that were very worrisome. She ended up dying of cancer. Malignant histiocytosis, which is a not uncommon Bernese mountain dog problem. It was obviously very sad, and I was just struck by, wow, this is just not good. And one of her litters, the little puppies, lived till it was 12 without being spayed. And it was the only one that lived past, I think it was maximum 9 years old in that litter. And so I just got on that path of wanting to know more about that. And we somehow came upon Linda Brent, I think it is, and Michelle Kutzler stuff, and just made total sense. So we started offering that mostly to large breed dogs that were prone to early cancer, such as the Bernese, the Rotties, Golden Retrievers, and the like. And mostly we did ovary-sparing spays, we call them, and some vasectomies, because, of course, if you can keep your male dog under control, there's no need to do anything. Just leave it intact. But if it's going to have a tendency to wander, you've got other females in the midst, you'll want to do the vasectomy. So that's basically the very short, high-level version of how we came to be offering these procedures. And we've been doing it ever since. And I guess we've probably done, minimum 150 by now of these things over the years.
I find it really fascinating to see how pretty much each of us who have been really passionate about hormone sparing sterilization and hormone replacement therapy, we all have had a dog who's taught us, who's guided us to the discovery. And once you learn something, it's almost impossible. Like you can't ignore it. You cannot do the old thing. And so our dogs are infinite teachers. And I really appreciate your story. And I can only imagine how heartbreaking and devastating it has been. My dog has just in quotation mark, been limping for, or had been limping for 3 years before I discovered that it was actually related to him being neutered and to the luteinizing hormone elevation. But, every story, whether it's Dr. Kutzler or Dr. Brent with Toby or your dog and Pax, they basically just guided us and have a very clear mission and message that this is not okay. And that's how we can help others. So now I'm really curious to see, Mike, what your story is of uniting with one of the really, the word that comes in, Moira, is feisty and very passionate and very integral veterinarian work.
Oh, thanks, Peter.
Mike is laughing, so I can see that there's something true in it for sure. And you know more than I do because we've never worked together. But Mike, tell me more.
Okay, well, I was a little slower on the uptake than Moira, in that I continued with my conventional practice till about 2010, 2011. I'd kind of gone on a little journey myself where I'd always been open-minded, but never really ready to take the plunge into holistic medicine. I found myself on antidepressants at one point and rotated through a bunch of them and just didn't like the effect. And finally came across some information about nutritional management of depression. And it started me being more interested in how I could apply this at work. So I bought a book with all kinds of holistic treatments for animals, a big textbook, and I worked my way through it. And it had everything in it: chiropractic, acupuncture, Chinese herbal, organotherapy, light therapy, homeopathy, everything. And what struck me as the most interesting one at that time was homeopathy. And what I liked about it was that it can actually cure. That was like completely mind-boggling to me, because all I'd ever done with drugs was kind of patch up, just sort of
mask the symptoms
and relieve suffering, exactly. Which it's nice that we have those drugs, but I was very excited about the potential of actually curing cases. And so I ended up finding out about the homeopathy course that all of us had taken with Richard Pitcairn, and I decided to take the plunge. So I took the course, and then I wanted to treat everything with homeopathy. I had a practice at that time, and I was so excited that I thought I better sell the practice, because if I convert everything to homeopathy, I'll have to fire half my staff. Nobody will ever buy my practice when I'm ready to retire, because I thought at the time nobody else was interested in it. So I sold my practice and I started doing I still kept working there a little while, but in a small capacity. Then I started doing a house call practice, and I have to say that turned out to be a little bit unrewarding for me. I didn't find it stimulating enough somehow. And I started doing some locum work for other vets. And then eventually I asked Moira if she needed any help. And she said, sure. And so I started doing some surgeries for her. And then very quickly, she started throwing me into appointments. And I started at 1 day a week, and then 2 days a week, and then 3 days a week. And then finally, we decided to go all in. And I let go of all my other work and then just started working with Moira. And you're right. She is very spunky. She's not afraid of anything. And she's been very inspiring to me. But that's how I came across the hormone-sparing sterilizations. And I quickly agreed with it and started doing them. And so, that's kind of how I ended up where I am.
That's really inspiring. So you guys are in Kelowna, British Columbia, right? Canada.
Yes.
That's about 5 hours from Vancouver, I believe.
It's 4.
You're a fast driver, I can only imagine. So, just for everyone else, I know that most of you who are watching have seen some of the materials and emails and description of what happens when the ovaries and testicle, the gonads, are removed. But I'm just going to do 1 or 2 minute review just for everyone to just kind of be on the same page. And then I really would love to hear from you what you've been doing and what your experience has been, and maybe talk about the differences between the conventional and hormone sparing spay and all that. So just to kind of do a really quick hormonal overview. So there are three kind of parts of the hormonal system when it comes to testosterone and estrogen and other hormones production, and that is hypothalamus, and then pituitary gland, and the gonads, the ovaries or the testicles. And this is obviously, I'm not explaining it to you, Moira and Mike, but for everyone else. So I see the hypothalamus as the general that gives the commands to the captain, which is the pituitary gland. And the pituitary gland basically regulates the hormone, or sends luteinizing hormone and follicular stimulation hormone and other hormones that basically tell the glands in the body to produce hormones. And when the hormones get to a certain level, then the production of the, let's say, luteinizing hormone stops, and the testosterone hormone will reduce, the production will reduce. So I always say it's like a flushing toilet. If you flush the toilet, the water refills, and then you flush it again and it refills, right? And it stops. So when the gonads are removed, then luteinizing hormone elevates dramatically from 0 to 3 to 90 or 150 units. And that causes inflammation in tissues and can lead to all these different conditions that you, Moira, mentioned and I mentioned at the beginning of this talk. So that's basically it. And, our goal is to transform the procedures, and they've been already transformed, but made them more general and made the conventional spay and neuters no longer ideal treatment. Well, it's been already shared that it's not ideal, but make them basically the technique of the past and move towards either leaving at impact for responsible dog lovers, as Sava is recommending, or for shelters and situations where we would not be able to control reproduction, to do vasectomies and ovary sparing. So now, you said that you've done about 150 over the years. Do still some people want the regular conventional methods, and do you do them, or do you just say, I'm sorry, but I won't be doing that?
No, we absolutely still do those, and that's the majority, wouldn't you say, Mike?
Yeah.
The majority. Yeah. So, for years now, our spay has been just ovariectomy, and that means the uterus stays in as long as it's normal. And that, is a less invasive procedure, less risky, smaller incision. And of course, they still lose their hormones. But most of the time, we were restricting that to small breed dogs because they do tend to live quite a long time, like 15, 16, 17, 18, even without their gonads on board. So that's our main rationale for that. But I would say the vast majority of the larger breeds that are so prone to early cancer, we did do more, way more ovary sparing space on the females than we did ovariectomies. So that's a good thing. And I have noted that those dogs, we don't see, and I think Mike would agree, we're seeing very little of the typical lymphomas and bone cancers, splenic tumors, and, in my dog's case, the Bernese with the malignant histiocytosis. In fact, I don't recall seeing another burner with that for the last 10 or 15 years. I really don't. Do you, Mike? You? No. So I feel like it's definitely made an impact on their lifespan. We, with the males, as I said, we've done less vasectomies because a lot of people can totally keep control of their dog, and it's not wandering the neighborhood sowing its oats, as I tell people. So if you're got good control of your dog, then just don't bother spending that money. You don't have to. But the ovary sparing space, yes, that's more important because you're going to avoid the bleeding during the heat cycle, no risk of pyometra, and, those are the main ones, right?
I would say, I don't know about you, Moira, but for me, I'm starting to do more of the smaller dogs. I'm starting to recommend the ovariectomy as well, although I certainly don't put a lot of pressure on people to do it.
Man, you meant ovary sparing spay, right? Yeah.
Yes, sorry, that's what I meant.
Because we'll get a lot of questions about that.
Yeah, yeah. So
Yeah.
the ovary sparing spay for smaller breeds as well, just mostly for the purpose of preventing obesity and maybe thyroid conditions and other inflammatory problems. I just don't see really a big disadvantage to also doing the small dogs for that. The only thing that holds people back sometimes is that we charge more for those, and sometimes they just want to simplify things and still go for the regular spay, which, as Moira said, they can manage. The smaller dogs aren't as dramatic as the bigger dogs when it comes to cancers and tumors and things like that. Now, as far as males are concerned, the reason we haven't done more of those is because, honestly, sometimes unneutered males can be a bit of a pain. They're not always the best pets. They get totally distracted by their nose. They're often peeing on inappropriate things. And so some dogs are a real nuisance that way. And so that's why we still do our regular castrations. But we always have conversations with people about these things. You know, it's a medical procedure. It has pros and cons. And it's important people are educated about what they're getting into. And so if the dog is really wild and crazy and never listens and is constantly peeing on things, then yeah, we'll recommend a regular neuter. But if they're super mellow and they're great dogs and there's no issues and the owners are responsible and they have them well trained, then there is no incentive to do a castration. So those are the ones that we'll do vasectomies on.
And I'll interject there that we always, when they're puppies and we're discussing spays and neuters, when to do it, or the hormone sparing, we always tell people that if you can really train your dog and it listens to you, then you're much better off letting them stay intact.
Yes.
Right? And if you just don't put the time in, then all bets are off. And of course, more recently, we've been suggesting for sure that people, even on the ones that are undecided, that at least let them go through puberty. Same with the females, let them go through one heat cycle and see how you like it. Like if they're not too broody and they're manageable and they're still active and everything else, then that would be a good sign of what's going to be the future for them through all their heat cycles and so on, if you decide to keep them with their ovaries.
Yeah, and
Okay,
also if they don't develop false pregnancies, because if they develop false pregnancies, then they have their heat for a month twice a year, and they have a false pregnancy for 3 months twice a year. So there's always some kind of hormonal derangement going on. So for those cases, then yes, letting them go through heat is absolutely a must.
Yeah, we have to be practical because some people they might have two intact females and an intact male or, something like that. And it's really tough for them for 6 or 8 weeks of every year to separate. They don't have alternative living arrangements.
I really enjoy kind of listening to what you're doing in practice, because I think that the observation, and you already knew that from the research, that the larger dogs are actually more affected by the hormonal changes. And that people just ask for regular conventional methods. And it's going to be interesting to see how everything evolves. I am hoping that regular and conventional methods will not be done at all, based on the newer research that Dr. Katzler has done. And there have been, other research centers that have been actually focusing on that. My sense is, and maybe I'd like actually to know your opinion. My sense is that even in dogs that are fully grown, the change that happens after spay or neuter is so dramatic that we are basically taking these dogs through, in quotation mark, menopause, and they're having all these different symptoms, including changes in behavior and, changes in their body, how they respond. My dog Pax started getting injured, and I basically stopped doing any of the activities that he loved. I have a feeling that there is no optimal time now to actually do the conventional spay and neuter with the information that we have. But you, Mike, pointed the behavior changes, and I actually have an amazing testing ground for dogs that are not neutered, and that's Prague. Because if you ever want to see dog paradise, where dogs basically are off leash, there is no bylaw officers, dogs are beautifully behaved in the city center. They're mingled with children and seniors, and everyone loves dogs, with the exception of some tourists. I observed really interesting patterns. When I'm in Vancouver, there's a lot of dog aggression, and I am now really eyeing and watching what goes on. And I'm noticing that the neutered dogs, the neutered males, are actually aggressive towards unneutered males. And based on the findings, when dogs get neutered, there is a change in some of the emotional centers of the brain, like hippocampus, and it's a hard word to say. And so I'm noticing that the neutered dogs actually are much more reactive, or they're more fearful with the unneutered dogs. And here in Prague, the same thing happens, but what I'm seeing that the unneutered dogs, the intact dogs, are actually, if they're let to sniff and just check things out, they're absolutely fine and they're mellow. Yes, you're right that they can go off and sniffing, or they try to pee on something, or Pax tries to, if he likes a female dog, then he figures out who the owner is and he tries to hump the owner's leg. So that's what he does. But overall, it's been absolutely striking. And, you have my standing invitation. If you ever feel like coming to Prague and just kind of watching this in reality, because we don't get a chance in Canada or the US to actually see these intact dogs and the intact females interact. And, health-wise, like I now know or look at a dog and I know whether they're neutered or not, based on how they stand, their posture, their mobility, their body shape, and how they look and how they behave. So it's really striking. What is your opinion about the behavior changes that you've seen with the unneutered/neutered dogs in Canada? Because it can be different. And, I'm sure that our viewers and listeners would really love to know what you think and what your opinion and experience has been.
Yeah, well, we definitely counsel people that if you're going to leave your male intact, it's more likely that if you go to a dog park, the neutered males are going to be the ones that come over and aggress against your male. And most of the time, the intact males will not initiate any aggression, but they will respond, right? Mm-hmm. So if they get attacked, they're going to fight back. So that is, something we do, at least I do tell people to be careful around the neutered males if you have an intact one. And I wanted to just let everybody know as well that if we're going to actually take away hormones from these large breed dogs in particular, we definitely wait until they're minimum 14 months. Mm-hmm. So they do go through one heat, the males go through puberty. And so the reason we do that is it has been for years, we've been trying to get them to the correct strong conformation by allowing them to go through all the way until their growth plates close at 14 months or so. Could be 18 months for the huge ones. But if you do anything prior to that, you are putting them at risk of tearing their ACL and just having problems with their hocks and their joints, almost not guaranteed, but you can pick out the early neuters at the dog park for sure when it's a taller breed because they're very straight or post-legged, I tell people, so they don't have strong conformational angles anymore. And so you can tell the ones that have gotten neutered and spayed too early.
Yeah, it's interesting what you're saying, and I fully agree that, neutering dogs at 2 months is, in my mind, with the knowledge that we have, not okay at all. But strangely enough, my dog Pax was neutered at the age of 18, and he grew up very strong. And when I look at his early pictures, like he was like muscled and strong. And as
18
soon as
what? Sorry, 18 weeks or
18 months? Did I say 18 weeks?
No, you
just
said
said 18.
18 months. Yeah, sorry, 18 months. He basically had very strong bones and joints, but he lost the muscles. And the muscle basically was unable to pull the relatively robust body. So he started getting injured. Karen Becker was actually visiting in Prague with Rodney. It was right at that moment he started limping. We offloaded, he jumped out of the car and he was limping. The next day he was limping a little bit. And then it was the front legs. Since then, he basically, until this spring, when I put him on hormones, he was unable to hike and swim and do all that. And it was just absolutely heartbreaking. So I know that the general kind of thought is that if we neuter dogs later, that it may be better. But my personal experience is, and this is just one dog, right? But it would be really interesting to do some research and see if some of the challenges remain to be present, even though dogs get later, especially the larger breeds. Mike, what is your thought on that? And what have you seen in practice?
Can't say that I've gotten a really good feel for it. Still, the majority of dogs are spayed the regular way. A lot of them we haven't seen since they were puppies, so they'll come to us at an older age. So we still see mostly spayed and neutered animals the conventional way. Certainly, we have conversations with people, and I would confirm that neutered dogs often do initiate aggression with the unneutered ones. I have heard that. I hear sometimes that females that retain their hormones will be a little bit more dominant or aggressive towards other dogs while they're in heat. So I hear that, but I can't honestly say I have a really good feel for the overall population of what it does to them. I haven't had the really in-depth follow-up with every single case kind of thing. How about you, Moira?
Yeah, the same. I mean, my own personal experience, just to carry on from the Bernese, after that I got an Irish Water Spaniel, and she did everything holistic with her, no vaccines, raw food, left her completely intact. And she was, a little bit of a handful, not going to lie, like that breed is not super easy in general. And anyway, so she ended up around 10 years old getting pyometra. So I'm in there doing the surgery to remove the uterus at that point. And one ovary is obviously not normal. It's enlarged. So I took it out and it was cancerous. So that was interesting. That's the first and only time I've ever seen that in a female dog. Just so everybody knows, we've done thousands of dogs, and that's the first one. And then she proceeded to get mammary tumors, which eventually at 13, just about 13, I had to put her to sleep because it had spread to her lungs. So there is a risk. It's not as big as I thought the risk was, but it's just like this particular dog was showing me everything possible because she also got anal gland cancer. So I was shocked at all the things that went on with her. But I wouldn't go back and change anything with her because she was very much a puppy up until the last 2 months. Like, she was just a wonderful dog.
The quality of life was there. Well, we discussed this with Michelle and Linda at the previous conversations, that there's 25% chance of pyometra in dogs that are unspayed, and that it would be actually advised to do ovary sparing spay in the female dogs. And that's what we kind of generally agreed on. And, when it comes to breast cancer, for example, we know that most of the lumps are benign, but they can be cancerous, as we all know. And I've been kind of poking into the role of the luteinizing hormone in anything that unneutered females and males have, whether it's prostate enlargement in males or mammary cancer, ovarian cancer, and so on. So based on the human research, and I've been, looking at some different studies, it appears that the decrease of the natural hormones, and I'll talk about males, leads to apparently prostate enlargement. So decrease in testosterone, which is natural in males, leads to prostate enlargement. And the reason why I looked at these studies was that, in humans, benign prostate enlargement is a very common problem. And it never afflicts 18-year-olds or 30-year-olds. It afflicts the 50-year-olds and 60-year-olds and plus. So it looks like when the gonads don't produce enough testosterone, the luteinizing hormone elevates and start inflaming the different tissues that are sensitive to the luteinizing hormone. And in females, it may be too. I haven't really done as much reading in that area, but there's a possibility that if we somehow reach for hormone replacement therapy at the right time, now the estrogen kind of harm has been debunked, and we know that it actually doesn't really change rate of cancer or anything. At least the latest studies said that it's actually safe. So if we start hormone replacement therapy at a certain point when the natural hormones start declining, maybe we can actually prevent all these different issues that would otherwise come up, maybe including pyometra. But I probably wouldn't take a chance with my own dog, my own female dog, to actually wait until pyometra happens, right? Or do some sort of experiment. So right now, I think I'm pretty clear on the male dogs, but not as clear on the female dogs. Plus, the cycle is a little more complicated, obviously, in production of hormones. So practically, can you tell me, is it more, like I've never done hormone-sparing spay and a vasectomy. I used to just remove ovaries, ovarectomy. How much more difficult is it to do vasectomy and ovary-sparing spay? Is it more difficult? Is it less difficult? What are the
With
challenges?
the ovary-sparing spay, yeah, we have to make a longer incision and probably double, because you have to bring the ovary up to the incision, which is near the kidney, halfway along the abdomen anyway, and then down to not quite to the pelvic brim, but something close, because you're also getting the cervix out, right? So that's way down there towards the pelvic canal. So it is a bit longer. It takes longer. We're very careful, I should say, to remove the entire uterus at the ovary end so that there's no tissue there that could
swell up and cause problems, right?
Yeah, so it's not going to it will never get infected. The reason why they get pyometra, of course, is because their cervix is relaxed or even open during a heat cycle, and bacteria can move in there and cause a problem. So when you've disconnected the uterus, the horn way up at the ovary from the rest of the uterus, and the outside of the body, then you're not going to get an infection, but it could cause some tissue inflammation up there. So it's a bit techy, takes longer. You're taking out much more. You're tearing through that broad ligament that supports the uterus. And having actually on that note, I just wanted to interject there with the urinary incontinence, because we have found, since we started doing ovaries out only, that has been since around the early 2000s for sure, we see way less urinary incontinence.
Agree,
like
10%.
10% maybe, compared to when you take out the uterus. So for people who are still wanting to spay their dog, they should really insist that the uterus stays in as long as it's normal, which it most often is, of course. Yeah, and as far as the vasectomy, it's just 2 incisions instead of one on each side of just in front of their scrotum there, and you have to locate the spermatic cord and then just get the vas deferens, and then you have to find that little spermatic cord and cut it.
Yeah, it's technically a little bit more challenging, but mostly because we don't do it as much. It's all about what you're used to. It was even for me when I first started doing ovariectomies, it was a little tricky because, you have to tie a different part of the uterus off and, there's fat around there and it's hard to sometimes see exactly where you're doing it. And so it's all about what you're used to. I would say definitely, as Moira said, the incision is much bigger with the hysterectomy or ovary-sparing spay. And there's 2 for the vasectomy. And it's a little tricky at first to find that vas deferens because it's kind of hiding in there a little bit. But once you're used to it, then it's no big deal. And it's certainly, as far as risk is concerned, I suppose in a big fat dog, doing a hysterectomy would be a little bit more risky than doing an ovariectomy, but not much.
Hopefully they're not big and fat because they still have their hormones.
Yeah, that's true. But you know what I mean? Some dogs just have more abdominal fat than others. So.
And, we did try, or I did anyway, years ago now, some of the hormone replacement therapy, because I personally and my husband have been on it since around 2011. So in around the same time as when we started all that and have been continuing ever since. And so I thought, well, maybe dogs could get some progesterone cream and or pills. But there was no information about it. And I had no idea on dosing and frequency because they just cycle so much different. So that kind of petered out. And we did a few testosterone injections on some of the males that were incontinent. But it's just not a big part of our practice, to be honest.
So, Mike, it is my understanding that you have a male dog that is neutered, right? Can you tell me about him? How old is he? Who is he? What's his name?
His name is Louis, and he is now 11 years old. He's an English golden retriever, so he's white instead of golden. And he's a little blockier than a regular golden retriever. Anyway, we held off on neutering him till he was about 15, 16 months or something like that.
Mhm.
And my wife more or less insisted on it. She isn't as, into all the science as the rest of us are here, but she just found that he was becoming more of an escape artist all the time. And he was constantly following his nose. He wasn't listening anymore. He used to be pretty good, but then he kept following his nose, and everything was about smells. And plus, he started to have a kind of a little bit of unattractive discharge happening from his prepuce. And so she just kept pushing me. And finally said, I held off as long as I could. And finally, then I said, okay. So he's basically done well. As most golden retrievers, he struggled with some allergies. But even that, I mean, I have actually never vaccinated him. He had a vaccine when we bought him as a puppy, but I never vaccinated him since. And he's never had any problems that way. The ear infections kind of went away after a few years of age. It seemed to stabilize. And yeah, he's been pretty good until the last few months. About 6 months ago, he developed what I believe to be degenerative myelopathy. I x-rayed him all over, and he has zero arthritis, which is really great. But yeah, his back end has been quite weak. Months ago, I gave him that Supralin implant that we're using now, which is the hormone that reduces LH levels in the body. And I was hoping it would fix it. Well, it hasn't fixed it, but he seems to have stabilized. Like, he is managing surprisingly well. A lot of dogs, when they start showing that, within 6 months, they're kind of, not able to do very much anymore. And he still goes for his walks and climbs stairs. So, I could say that it slowed things down, but I can't say that it's fixed it.
And I wouldn't expect it to be fixed, actually. And the reason for that is I was very curious as well what the Supralin will do on its own. So I put packs on Supralin for 1 month. And he actually, initially, it felt like, all the muscle inflammation and his twitchy back and all that stuff kind of reduced. But then he started being really itchy for like crazy. He actually lost almost all his fur. He looked horrible for a couple of months. And so I arrived from Maui to Vancouver, and I started him on testosterone. And within a month and a half or 2 months, I felt like I had a completely different dog. And it was not only the fact that he started being more mobile, but it did take some time. And then suddenly it was just like all the channels and the metabolism basically has totally changed. And he's been amazing ever since. When you put him, or if you put him on testosterone, that you're going to see profound change. And we did use laser therapy, and I started using, I even formulated a product for him a year ago or so, because I was thinking, I don't really know why this dog is limping. Then obviously I discovered that he was suffering from the hormone deficiency. So I would be so curious, like, obviously you're a vet, it's your decision, but I would be so curious to see what would happen with your dog if you put him on testosterone. And we give it weekly, 0.5 milligrams sub-Q, per kilogram sub-Q. So it's really small dose and, small insulin needle. And that's what Linda does as well, using the same dose. And what they said, actually, that the once a month dose takes them through this really big roller coaster where it goes really up and then they drop down, right? And the behavioral changes were actually really something that I've noticed the most dramatic. Like I kind of felt that after he got neutered, that I lost my dog. He was just kind of more sleepy. Like when I looked at him, he was looking down, right? And now he's like naughty, and he ran away a few times, like in the park, but I have a tracker on him. So there are some side effects, of course, but yeah. So yeah, anyway.
What kind of testosterone? What form?
So it's just regular cypionate, testosterone cypionate. That's what I was able to get. And, it's really inexpensive. Like the whole vial is really like nothing. And it lasts more than a year. I will need to replace them because, after a certain time, you don't want to be poking the needle in the bottle, in the
Yeah.
vial all the time. But
We do have some at the office too.
yeah,
With my own, I was going to talk about Lacey, but Lacey is my bully. So she's almost 7 now. And I decided because of her very explosive nature, I just love, but they're very bouncy and, twist and turn and knock people. So I decided after her first heat, I was going to spay her, the ovariectomy. And she had already been, a little bit showing some allergy symptoms, but it just kind of worsened over the months, I should say. And so by just over one, I had to, after trying different homeopathics and herbs and so on, I just had to put her on Cytopoint. Okay, so she was getting Cytopoint, which is a monoclonal antibody against allergies, for those that don't know. And it shuts down one of the interleukin molecules so that they don't feel itchy. The allergy is still present, but they're not itchy. And that works great for her. It lasts anywhere from 10 weeks to up to 5+ months. But I decided to, when the Supralin implant became available last year, after talking with Michelle in June, we decided that's what we got to do.
I definitely see that golden retrievers are prime candidates for this. And weirdly enough, my dog Pax, even though he's a border collie, he acts like a golden retriever. He's the same body type. He's a little larger. He loves water, loves to fish. He puts the paw on me when I scratch him, right? Like the golden retriever way. So it's so interesting that what you're describing, Mike, is actually a body type that I know very well. And, some dogs are, and bullies as well. I definitely see that inflammatory tendency. It would be interesting to see what their luteinizing hormone was before the Supralin, right? But my sense, at least based on my experience and what Linda and Michelle said, that without a hormone replacement, just the Supralin, that it can be challenging. So it's good that you're not seeing any major problems. Pax was not very happy camper on its own. But as soon as I put him on testosterone, what happened? He stopped itching. That was like, he was absolutely fine and his back aligned. And I was thinking, how could it be like without any chiro or anything? Suddenly I have a back that is just like, solid. It was so interesting. Yeah. You'll see a huge difference actually, Mike, if you try it, I think. And laser in the process just to kind of stimulate the mitochondria and the muscles just kind of jumpstart. I don't really know. I started using the HRT and laser and joint butter at the same time. So I don't really have a double-blinded study on this, but I'm really happy because how it feels like when our own dogs are actually unwell and we can't solve it. Like it's just really
I think I'll try.
Yeah, you should, Mike.
Yeah.
Yeah. So I decided to give her the implant. She's had 3 now. Last September, March, and then again September, because it's every 6 months. It can last longer for small breeds and much less time for large, huge breeds over 200 pounds. But anyway, what I noted so far is that her allergies are probably 30 to 40% improved in that they're not as aggressive, and I can use my Cytopoint shots last over 5 months now, which is really good. And most notably, though, she's a happier dog. So it wasn't a side effect I was anticipating, but people were noting after a week or so of her having had it last September that she seemed happy, and they didn't know what I had done. They just were commenting, "Oh, Lacey seems so happy." And that is true. She's more active, more initiating play with our other dog, Kiva, who's a sheepadoodle. And I just really am very impressed with the effect of the Supralin on her. And we've had other clients whose dogs have improved with their anxiety. So I think that is a great rationale for using it, is dogs that are anxious, especially if it worsened after they were had their gonadectomies, whenever that happened.
Yeah, and this kind of change is actually, it makes complete sense because if the amygdala and the hippocampus,
I say hippo.
hippo like a hippo, okay, I'll remember it from now. If they get inflamed as a result of the luteinizing hormone basically affecting it, then it would make sense that as soon as it reduces, these brain centers actually will become less agitated and inflamed, and there will be change in behavior. What I've seen in Pax, when I flew with him, he became more anxious after he got neutered, and now it's getting better. There is still some habitual kind of remnants of his behavior, but he settles down after takeoff and he's much better. So yeah, it's cool. Yeah. And I'm not really sure how much time you have still left, but maybe.
About maybe 15 minutes.
Okay,
Yeah.
great. What will people be asking and wanted to know? Like, what is the cost, the difference in cost of the regular conventional spay and neuter and vasectomy and an ovary sparing spay, at least in your clinic?
Yeah, it depends on the size of the dog, of course, and we run from a minimum of 1,100, and I think we've charged up to 1,600 or something. That doesn't include the extra things that people might want, like blood work first or IV fluids and all that, which we're making pretty much mandatory for that procedure. The checkup, we might start with a phone consult because some people do drive from, the islands, Saskatchewan, we've had that, Prince George, Alaska, even, so that there are some, we have to talk to them first and make sure that they know exactly what they're getting into before they come down. So phone consults cost a little bit. And then once they get there on the morning of, then we, charge a checkup fee as well. So it's probably triples the cost, I would say, from a regular.
Reduces all the different challenging medical conditions that have been linked to.
Yeah, so that's how you explain it. You're helping them out, even if it's not obvious that it's helping prevent cancer in these early spayed and neutered big dogs like the Bernese. You can't see that. It's nebulous. It's like you can't say for sure that they had cancer and now you prevented it, because you just never know. But you are increasing the chances that they won't. Like you're mitigating against the risk of cancer. So that's how it, one way of chatting with owners is just that. Like some things are going to be obvious. You're going to keep them slimmer. We all know that spayed and neutered dogs have a tendency to get rotund quite quickly. Like literally, they can put on 10 or 15% of their weight in 6 or 10 months, right? It's ridiculous. But ultimately, you're just helping them out because you're keeping their hormones in balance. So that is one way of explaining it. And I also bring up the fact that when menopause and menopause hit, sort of in that late 40s, 50s, that's when all the problems begin for humans. You gain weight, you get moody, you can't sleep. There's all kinds of cancers start hitting, strokes. And so that's one reason why personally at that time, I just fooled my body into thinking I'm still in my mid 40s.
Yeah, you look great, by the way. You graduated 1 year before me. And I think that, Mike, did you graduate? I graduated in 1988.
I am the senior here. I graduated in 85.
Oh my goodness. There you go. 3 years. So we were at vet schools at the same time, basically, being indoctrinated.
So it all makes sense.
There's another really interesting thing. If you talk or if you listen to interviews with people who had ovariectomy early on and were basically forced into menopause, they describe the changes as horrendous, actually, from brain fog to inflammation all over the body and inability to basically function and exist. So this is an interesting one. I find that the accounts of people who've gone through this actually really convincing. And for those of you who are watching right now, you can go to hormonehealthfordogs.com and basically all the different research, including this interview and every other interview will be on that page. And I'm just so grateful to both of you actually taking the time as well and making sure we have this conversation. And I feel like we could go forever, and we do have maybe a few more minutes, as he told me. So, Mike, is there anything that you'd like to add? And maybe if you do have an opinion as well, after you add whatever you want to add, how do you think we should approach the animal shelters and rescue organizations? Because I feel that there's still a natural resistance to worry that we will have increased homelessness, and we know that is not necessarily true. But what is your opinion, and is there anything else you would like to add?
Well, one thing I wanted to mention before I forget and get onto the Humane Society stuff is that the Supralin implant, which lowers LH levels in the body of neutered animals, that hasn't been available to us that long yet. So we haven't used it on a ton of animals yet. But I did have one case, I specifically used it for incontinence instead of using the usual stilbestrol tablets and those kinds of things. And it responded beautifully. She never had been incontinent after that. So that is one other application that you can use it for. And I would say, Moira, some of our patients have more easily lost weight, wouldn't you say?
Yeah, no, there's definitely some benefits.
Yeah. So that was one thing. As far as what to tell SPCAs and other humane associations, to be honest, I haven't really thought that one through. I would overall say, if I think about our experience, there's very little preventing us from doing ovary sparing space. And so my first impulse reaction to what to tell an SPCA would be that ovary sparing spaying would be quite appropriate for almost everybody. Well, unless, of course, okay, here I have to take a step back now. Unless they're going to be the ones that have these false pregnancies all the time. Or actually, it brings to mind one case where I was overzealous when I first started working with Moira. I recommended an ovary sparing spay for a crazy husky puppy. And they did it. And the next heat cycle, they were just about going crazy. And they ended up getting the ovaries removed because this dog wouldn't eat while she was in heat. And she was totally even worse escaping than huskies normally do, and just driving them nuts. They were so worried they had the ovaries removed. So no, I can't honestly say that SPCA should be doing this carte blanche, because you have to see how they behave through a heat first. And if the SPCA has a policy that all females should be allowed to go through a heat first, there would be way more unwanted pregnancies statistically.
But you could do a tubal ligations and vasectomy, so they really should switch up their surgery. Tubal ligation.
This is a conundrum, because if you think of letting them go through the first heat, obviously that would be a problem in population control. And I think that rescue organizations and shelters would probably not opt for that. But if they want to do the early procedures, they will continue doing them, at least some of them. I think that the ovary sparing and vasectomies are the way to go, and then see how these dogs behave. The other thing that I was actually thinking are the behavioral changes, or should they be prioritized over the general health of a dog? I think that more research needs to be done, and we need to have more understanding what the ideal protocol or protocols are, then go from there. So this is where we are trying to kind of organize the community, and Dr. Michelle Katzler will be going to different colleges, and we are trying to fundraise and organize continuing education for veterinarians and vet labs all over North America and Europe. Europe is actually a little different, and this is why it's so interesting to see the contrast of behavior and being able to compare like what's happening with dogs that are generally neutered and spayed and the one that is generally unneutered and unspayed. It can cause some problems, when in October, for some reason, all the females in Prague were in heat. So Pax actually had a few girlfriends going, and, whenever we met them, he would be super happy and so on. But it wasn't really a situation that would be out of control. And most of these females, actually all the females, were on the leash. So, if they tried to kind of run away, it wasn't possible. So, yeah.
I want to just interject there again one more time on the early procedures. I feel strongly that it should be a tubal ligation, because then they're still got all their parts. But if you take the uterus out, it's gone forever. So you've sterilized them, but you give the option to somebody to just do an ovariectomy later if they're not happy with the heat cycle. And that, leaving that uterus in there has some benefits. So I don't think, and it's also much easier.
That's interesting.
It'd be much easier, smaller incision, much faster. If you just have to pull up the ovary, tie off the fallopian tube, and put it back in, you're done. Right?
But I did one of those.
Would you worry?
I had an opportunity to do one once many years ago, before I even knew you. There was a guy who wanted his dog to be able to experience the full spectrum of being intact. And I did a tubal ligation on this dog, and she was back within a year with pyometra, because he had allowed her to be bred And somehow,
Well, I don't see how that would be related to the tubal ligation, though. So we've seen pyometra in early, like even on a first heat cycle without being bred. I've seen that twice.
yeah, so it's just odd. It was suspicious to me. It scared me a little bit. Like at that time, I was still doing mostly regular space where I took everything out. And this is like 30 years ago. And I did this one tubal ligation. And within a year, it was in with the pyometra. So I don't know. It was just an anecdotal experience.
I love that we have slightly different take on things, and just obviously based on our experiences, we are making decisions and suggestions and all that. And this is actually lovely because people see that this is a really honest conversation where we're just kind of getting together and having a good chat. Because I think that for an average dog lover, caring, loving dog lover, it's kind of cool to see that we have these discussions, right? Nothing is written. Medicine is not black and white, and we just have to make decisions based on the particular situation. And that's what I really enjoy. And, I can't even thank you enough for spending the time here today with me and sharing your wisdom and knowledge and experience that I don't have, and that we could share actually our experiences together and hopefully create a change that is so much needed. And so the only last thing that I would like to ask, if people wanted to connect with you and wanted to bring their beloved dogs to you for hormone sparing procedures, where can they find you? What is your website?
We are at positivevetcare.com. So positive, of course, is PAWSITIVE, vetcare.com. And, there's Facebook as well. People can connect on there and Instagram with private messaging. So, we're interested in educating people and continuing with this project, I guess you could call it, of helping dogs, right?
And you work in the same clinic, correct?
Yes.
We're both 4 days a week there, and we just added Dr. Savannah So, who came out from Ontario. So she's been there a couple months now, and she's completely, like, her and us three are all exactly on the same page. Just throwing that out there.
And that's really great. It sounds like you have a good match there.
We do. It's really amazing. We're completely different people, Moira and I, and so is Savannah, and we all seem to just
gel.
Yeah.
Yeah, and that's what it is about. I think that it's just so much nicer to work with like-minded people. I often imagine work as a pod of dolphins, playing and catching fish and figuring out how to do it the best way possible. And for us, it's to make a difference and rescue the animals who need our help. And
I would definitely catch more fish, Mike.
Moira is like the Energizer bunny.
Oh, I
she
know.
does more than everybody else, and I'm the sort of slow and plodding, methodical one.
Well, there's always HRT for all of us at a certain point. Like, I'm just wondering whether 10, 20 years from now, like, it'll be just normal way to go. We are not programmed to live as long, right, as we do. So I think that this is like a medical revolution, because when you think of all the different medical conditions that we could possibly prevent with some toss-ups here and there, obviously we know that there are certain conditions that are related to intact animals. But overall, I think that veterinary practice could actually look very different if we adopt these methods, and it's so fun. Everyone, I'm just so thrilled to have these amazing people here. If you want to get in touch with them, please do so. Moira, Mike, thank you so much.